My name is Chaya Murali. I'm a pediatric genetics physician at Baylor College of Medicine in Houston, Texas. And I've had the pleasure of working with Tango 2 families for 4 or 5 years now. And first, I'd love to start with you guys introducing yourselves.
Shall I start, Giorgio? Yes.
Yeah, please.
Hi, we are the Pochettino family. We are living in Italy, and we are so lucky that we have two children with Tango 2. Our oldest son, his name is Eduardo. He's turning 10 years old this year. And the youngest one, Carlotta, she's 8 years old. And they have, I would say, diverse stories, very different. And so I can give you just a short insight about their story. That is, I'll try to be short, but of course, I don't want to, since unfortunately Eduardo has a long story. If I'm too long, please tell me, and I will skip some pieces.
Yeah, please go ahead. We'd love to. Yeah, I was just going to ask, tell me about their stories and what makes them so different. So please go ahead.
I'll just tell in brief Eduardo, and then you will see what Ente Carlotas, and you will clearly realize what the differences are. So Eduardo, when he was born, I think already at around 6, 8 months, we start noticing he had some delays. For example, it was some motor delays. It was not crawling. It was not trying to stand up. And also from the cognitive point of view, he was not really trying to copy what we were doing. So, for example, he was not he was not saying hello with the hands, or was not trying to repeat the sounds we were producing. So we had a feeling that something was not going as it should. But at the time when we consulted doctors, they told us that we were still within the range. So it was a little bit delayed, but nothing to worry about for the time being. So we continue as it was. But then when it was more or less, it was 1 year old, he got a simple fever. And suddenly our history started, because in 24 hours, we were in the emergency with him, that we didn't know what he had. He couldn't move, and he was basically in the bed. The doctor didn't know what to do, and they tested. I don't remember even why they tested CK levels, and they found out it was very, very, very high. They couldn't believe, and I recall that. With Giorgio, they were saying, "Oh, the machine is broken." Actually, it was not the machine was broken. With the level were so out of range that was they couldn't believe what they were seeing. It was what was coming out of these results. And so from there, we stayed in the hospital 3 months. Eduardo got worse in the first period. Because he had also deficit in sodium, problems with heart, cardiac impairment. So it was really tough, especially because doctors didn't know really what to do. They did their best, absolutely, but it was just a try. They tried to keep him alive, basically. And the second episode, that was 1 year after, was more or less a copy of this first one that I'm telling you about. Actually, the thing was even more severe, because at the time of the second episode, there were cardiac complication, and and Eduardo had a cardiac shock, so the heart stopped basically beating, and we were lucky that we were already in the hospital, because if this was happening at home, he couldn't survive. So the two episodes were really a picture, were specular. So the same trend, the same CK level going up and then suddenly going down, the heart at the beginning being normal and then suddenly having problems. So we're really similar. And in both cases, we ended up and we were discharged without a diagnosis at the time.
Mm-hmm.
So the first time, doctors thought maybe it's an isolated case, and we went home with a normal treatment and a recovery diet, etc. In the second case, of course, it didn't told us that it was an episode, but there was something going on, but they didn't know what could be. And
Mm-hmm.
from there, we started a genetic research, and we did whole exome sequencing for myself, Giorgio, and Eduardo.
Mm-hmm.
And we waited some time the results, but when Eduardo finally was nearly 3, we got a reply, and the reply was Tango 2. That was discovered. There was a first publication a few months before from Dr. Lalani.
Right.
So it was really fortunate, I think, for us to get to have done this sequencing just after a publication of an article,
Mm-hmm.
because otherwise we would have wandered for years probably looking for a reply.
Yeah. So it sounds like you got genetic testing during his second crisis episode, but you waited several months for the results. Is that correct?
Yeah, correct. Because
Yes.
the attack was in the summer, and we got the results in December.
Okay.
But between the first and the second attack, we struggle to get the diagnosis. So we make also other genetic test, but we just make a panel test.
Mm-hmm.
So the wrong approach was that was bottom up and not top down. So at the end, we decided together with the doctor that was necessary to make a full screening. This was a good results, but to be honest, some doctors were really skeptical about that, and they tell us to not do it because they were afraid to get difficult results to be understood. So this for
I
this
see.
reason we push on that. We make the sequences in 2 places, one in Italy, in Milan, and the other is in UK, in London, in
Mm-hmm.
parallel. And we got the same results.
I
So
see.
at the end, we discovered that. But at that period, for us, Carlotta, that she was born 1.5 year after Eduardo, so she was um, about 1 year old.
Mm-hmm.
She was completely okay, but we push to make a test also for her.
Mm-hmm.
Even the doctor, they said it was not necessary because she was really different compared to Eduardo. So she was really able to move really actively, and she was copy like was Russian
Yeah.
was in the beginning compared to Eduardo. So we just did it because we say, okay, why not? This was
Right.
the point. And we discovered that also Carlotta had the Tango 2 mutation,
Mm-hmm.
and it was really a big surprise for us, but more for the doctors because they were not expecting to have this mutation. And to be honest, now she's 8 years old, Eduardo is 9 years old, and they're completely different from daily life. So Eduardo, she has problems. Uh, he has difficult to walk for, difficult um, to learn, even if he likes to be to be at school or to be with teachers to learn. But instead, Carlotta, at the moment, we cannot say that she has a real delay compared to the other schoolmates.
Okay.
Even she has a mutation, exactly the same mutation as Eduardo from genetic point of view.
Right. Now, you said that Eduardo had two crises before he was diagnosed. It sounds like Carlotta was completely healthy before she was diagnosed. Has she had any crises?
Not at all.
No, not at all.
And I know that a lot of the families have put their children on B vitamins and noticed a significant improvement with that. Do you think that did Carlotta start B vitamins early in life or earlier than Eduardo? Do you think that made a difference, or do you think it's something else, or do you know?
I think it's difficult to prove because it's difficult to have the we don't see the opposite scenario. What we can say is that from the beginning, before she took vitamins, she was much better than Edoardo. So we can say that before vitamins, she was not comparable to Edoardo. For sure, starting from 1.5 years old, she started to take B vitamins. Also, now that she's 8 years old, she's continued to take B vitamins. But it's difficult to
It's
to
difficult
prove
to
that
say.
the benefit is due to the B vitamins. Honestly, we cannot say that. But
Yeah.
On the other hand, with Eduardo, I breastfeeded him until he was 1 year old, and Carlotta, she was on a formula. It was also with some B vitamins. So we really don't know with now that we see it, maybe this was or could have influenced the fact that it didn't have crisis, but these are just a speculation, of course.
Yeah.
But what we saw that as soon as we got the results from the sequencing, we started supplementing also Carlotta's diet with vitamins.
I see. Now, I know that you guys have been involved in the Tango 2 Research Foundation and the family networks and everything. What do you hope that researchers will learn about Tango 2? What answers do you want for your children and for other children with Tango 2?
Good question. I think I have two answers. The first, I would like to understand from in the cell point of view what is doing the Tango 2 protein, because at the moment we don't know exactly what it's doing. So for me, it's important that we know the relationship between a Golgi and the other organism inside the cell, because at the moment we have some idea together with the doctors, but we cannot really be sure what is doing the Tango 2 protein. In the other answer is that I would like to find a cure. At the moment, the B vitamins, it's really helping the children, but from clinical point of view, the children still have effect from Tango 2 disease, so they have still a brain delay, they have a weakness. Probably B vitamins avoid the crisis that was the prior one, because the crisis can as a conclusion that the child could die. So from this point of view, this is a real benefit.
Yeah.
But we can say that B vitamins doesn't solve at the moment the disease from 360-degree point of view. So I think we should find it. We are thinking to make also genetic therapy. We see some risk on that, but we have seen also in the other diseases that the gene therapy, particularly for the severe disease, can be a solution, because it's solved from the root the problem.
Sure.
Because it's able to repair the genetic mutation. That's for me, it's also a way. I'm not sure that it can be applied for our children, because maybe they are too old for that. But the other side, I hope that the new Tango 2 disease, children in the future, they can use gene therapy.
Yeah, absolutely. Rashmi, did you have anything else to add?
No, I think our way is twofold. From one side, the long term, the research that I hope is not too long term. I hope it will be a medium term. But of course, the short term would be maybe to find additional treatment that will reduce furthermore, like B vitamins are doing great, but maybe there are something else, some vitamins that are already out there that could help us and improve the condition of our children even more, and allow them to have a normal life as much as they can. And if we do understand what the protein is doing, maybe it's not a cure, but maybe it's a definite treatment. I don't know. This is my hope, that I see it also more feasible in the medium term and maybe short. I
Yeah.
hope.
Yeah. Well, thank you so much for sharing about your children, about your hopes for researchers, and I hope those things too.
Thank
Thank you
you.
very much for the interview.
Thank you. Thank you for your interview, for your time.